I'm really excited to present our speakers today, and I've had a chance to peek at the slides. It looks really interesting, so I'm just gonna go ahead and read the bios, actually, just read it fully so that you can have some understanding the background of the expertise that Dr. Michael and Dr. Jason bring to the space today. So we'll be hearing from Dr. Michael Huff, and he serves as the HUD Office of Field Policy and Management in San Francisco Regional Office as a program analyst, and the Northern California Senior Community Liaison in place-based initiatives. He is an InfraGard infrastructure liaison officer, so that's critical infrastructure protection, and a member of the Regional Advisory Committee at the University of California Davis Center for Regional Change. And Dr. Huff is committed to addressing the social determinants of health by building community climate resilience through employing collective impact, place-based, and social innovation strategies. He holds a master's in clinical psychology and a doctorate in organizational leadership. So that's Dr. Michael Huff. And then presenting alongside with him will be Dr. Jason Wilken, and he is with the Office of Climate Change and Health Equity, the Office of the Assistant Secretary for Health, United States Department of Health and Human Services in Washington, D.C. And Jason Wilken is the CDC Career Epidemiology Field Officer assigned to the California Department of Public Health, where he builds preparedness and response capacity for natural disasters, acute chemical releases, and other emergencies. He has had leadership roles in numerous responses, including COVID-19, valley, floods, wildfire, drought, and earthquakes. And Wilken served as a 6-month detail to the HHS Office of Climate Change and the Health Equity in 2022. And he's an alumnus of the CDC Epidemic Intelligence Service. So just incredible expertise for us, and hopefully didn't bumble up the acronyms too much. So with that, I'm going to screen share here for them and pass the mic off to Michael here. So let me get the screen share going. All right, there we go.
Well, thank you so much. Give me a thumbs up if the volume is fine. That's great to see. Really appreciate the opportunity for you allowing us to join your forum and share and exchange kind of strategies. You know, we're in California, and California's right across the ocean from you guys. We have a lot of different issues, but some of the similar ones related to climate. So we look forward to being able to work with you today. If you go to the first slide. So the issue of climate is something that everyone's aware of and talking about now across the world. Okay, it's something that's happening globally because of the impact nationally that we're seeing. It's either raining somewhere or it's so hot somewhere that it's uncomfortable and there are concerns about heat. And so what HUD did is HUD has this tied into there that's focused on climate action, as Ramona mentioned, has it tied into the strategic plan, which you see listed there, and I won't read it or anything, but then you also see it tied into the climate action plan. So it's really timely that we're having this discussion. Really appreciate being part of this. Next slide, please. So the next slide, one of our departments that you're probably aware of, our program areas at HUD, is Community Planning and Development. And it's called, for the acronym is CPD, and they're the ones that have the block grant, the Community Development Block Grant. And they have one that's focused on disaster, and you can see some of the information there. There's actually a toolkit for building community resilience, and that's some of the things you'll see kind of, I guess, expanded in the rest of the presentation for us. You'll see some of those things expanded because, you know, we're learning. This is not a situation with climate that we can say, hey, let's study the impact for 5 years and then come up with a plan. You know, we have to respond right away. We actually have to be proactive, and that's why we're here today. Next slide, please. One of the things we did is I've had an opportunity to serve in what's called the Promise Zone, and the Promise Zone is an initiative that identified locations throughout the country that had issues with and were vulnerable with education, with workforce, with housing, with food, with healthcare, a number of different things. And you can see the map here of the promise zones. Now, what's unique about them, and the reason I point them out, is that the promise zone had 22 federally designated in urban, rural, and tribal areas. And then there were also finalists, organizations that, or cities, locales that actually did really well, but didn't make the final cut. And what happened is that HUD and USDA continued to provide technical assistance and support. And you can see those across the country. And they're in tribal areas and rural areas and urban areas. So what they have is they have a place-based, as you'll see there on the left, a place-based approach. So every location, as you know, in Hawaii, you probably have every location needs something a little bit different, something nuanced. And so the same thing happens with the promise zones in the states. And then finally, it's collective impact, which means you have faith-based, you have academic partners, you have community-based organizations, and you have federal, state, local, and private sector all working together on a problem, the problems that the community identifies. Let's see, next slide, please. And with this slide, I jumped ahead. I wanted to pass it over to our partner, because this is a federal connection, a federal relationship, whole of government. And Dr. Wilken is with, as you heard, HHS, which is Health and Human Services, and CDC. I'll let him go ahead and cover the rest of the information.
Hey, thank you, Michael. And thank you for the invitation to present. Dr. Franco, I should say that I'm probably going to crib some of what you said earlier. I had not heard the statement neighborhood as the unit of resilience, but I may be using that in the future, but I'll be sure to credit you. But I do like the idea of neighborhood being the spatial variable and generations being the temporal variable. So let me frame this discussion in terms of how partnerships can be built between community-based organizations and with health to build climate resilience. And so we already know what those successes would look like. We saw those during COVID response. We saw great partnerships between health and CBOs, especially as they pertain to addressing health disparities that exist in communities that are experiencing social discrimination. Specifically, adverse health outcomes related to chronic conditions are related to the social determinants of health. I think that's pretty well accepted at this point. And we know that those same chronic conditions that contribute to excess COVID-19 deaths, so we're talking diabetes, hypertension, obesity, respiratory diseases, those are all the same risk factors that we see for excess deaths from extreme heat, from wildfire smoke, from other natural disasters. And so the reason that I show this image of the Presidential COVID-19 Health Equity Task Force during the presentation on resilience, community resilience and resilience hubs is that the top recommendation of the COVID task force was to invest in community-led solutions to address health equity with flexible funding opportunities to address specific needs of the community. And so this provides really a guiding principle of addressing social determinants of health to build resilience against these concomitant threats, including those that are posed by climate change. So it's community-led efforts, not in competition with health, but in partnership with health. Next slide, please. Okay, so multiple federal agencies and state agencies and NGOs and academic partners, they're all working towards the goal of preventing or mitigating the impacts of climate change on people. They may not be working in perfect harmony. And here we highlight a working model, and we're referring to this as a climate health resilience hub. A climate health resilience hub is there to provide direct health and societal benefits to communities that are at disproportionate risk of climate change related health impacts. So the Climate Health Resilience Hub starts with key facets that were developed by USDN, that's the Urban Sustainability Directors Network. The hub first needs to be a trusted structure, and it should have local control, and it should exist to identify and address local needs, and adjust its community programming and services as needed to best serve the community. Okay, so this is a trusted physical space. It serves the community. It is not a top-down government approach, but instead a bottom-up community-led organization. And the programs and services provided by a resilience hub need to be year-round. These include, community services and programming, but also communications, building and landscape, power systems, operations, et cetera. This is a model that favors a combination of strategies that can retrofit, or they can otherwise improve energy efficiency and energy independence at the site, reducing greenhouse gas emissions, but also enhancing community of quality of life by providing services that are tailored to the needs of the community. And that's what it does year round. So the community resilient health, the Climate Health Resilience Hub is not a model where resources are pre-positioned for an emergency and that's all. Instead, this is a model of providing year-round community benefit that address those social determinants of health. But during times of disruption, the hub can be a physical resource for the community. It can be a distribution point for food and material and goods. It should have some degree of energy independence and be able to provide power and broadband access. It can be a heating shelter. It can be a cooling shelter. It could be a clean air shelter. It could have emergency water reserves. But most of all, the hub provides year-round benefit, again, addressing those social determinants of health. Health is in the title, and that's where healthcare has a perfect intersection with community partners, in that the hub should have a clinical or public health component. So the hub can be located or co-located with a community health center, or alternatively, could have a satellite office of a community health center for primary prevention, things like screenings and referrals, vaccinations, maternal child health services, testing resources, et cetera. Or it could have close ties with a safety net health center for helping identify and refer patients. But regardless of which model, the hub exists in the community in partnership with health. So bringing health into a hub that's already connected with all these other services is what allows the hub to address social determinants that can affect climate-related health outcomes. And the hub should also provide community education and trusted information about climate change, including referrals to services as necessary, such as weatherization services and energy efficiency services. I'm already learning just a lot from showing up at this conference. I had never heard the term clean energy wayfinders before, but I think that a wayfinder would have a perfect home in a climate health resilience hub, as they are there to help refer people to weatherization and energy efficiency services. The hub can also house civic engagement with programs like a Youth Climate Resilience Corps or other youth engagement. And it's also, finally, an integrated component of local emergency management. So the hub is part of the hazard mitigation plan. So they can efficiently assist the community during emergency responses. And finally, the hub has the means to braid together resources and technical assistance to accomplish these goals. These are a lot of things to ask one organization to do, and figuring out how to bring resources and funding streams together requires that hub to have that administrative capacity to braid and blend funding. Next slide. Okay, so no two climate health resilience hubs would be identical, and that's because they provide services and resources that are specific to their community, to their neighborhood, and every neighborhood's needs are different. So we conceptualize a climate health resilience hub first as being that trusted physical location in the community. It exists to serve community needs, and examples of some of those everyday needs are shown on the right. Next slide, please. Okay, so building on that, the hub helps build resilience to the health impacts of climate change by providing health and public health services to those at greatest risk. So again, this can be co-locating a climate resilience hub with an existing clinic or having a clinic satellite office for basic screening and referral services, or it can leverage safety net health centers. Those safety net health centers are often places people would naturally turn to during crises, and so they're well-versed in targeted outreach. So a public health presence can be the form of a satellite office for local and community engagement for immunization, MCH, or disease investigation, or whatever are the locally needed services for that community or that neighborhood. Next slide. The Climate Health Resilience Hub also serves the community during times of disruption. So examples could be mass testing or vaccination site. It could be providing emergency power, emergency cooling, clean air, or being a staging point for distribution of resources. But this requires the hub to be integrated into local emergency management. And so next slide, that brings us to state and local government and services to help transform the surrounding community and provide service access to those historically underserved groups. So by actively engaging with local government, the Climate Health Resilience Hub can fulfill its purpose of providing not only emergency services, but also year-round community benefit and fulfill those key functions of services and programming of building and landscape of power systems and of operations. Next slide. So note, health and medical is listed at the center here. And that is because the Climate Health Resilience Hub is there to be proactive, not just for disasters, but sorry, let me start that over. It's not taking a reactive approach to disasters. There is a proactive approach to identify those people who are at greatest risk of health impacts when a disaster strikes. Okay, so this is an intentional effort to build capacity and resilience within vulnerable communities, either at an urban setting or tribal or rural setting, but also to replicate this concept across the country. And so a perfect partner would be one who can bring the power of convening, one who can provide technical assistance to get the hub all of the resources that are needed for this sort of somewhat lofty ambition of building climate health resilience to communities that have historically been redlined or otherwise experienced social discrimination. And so to talk a little bit about bringing those technical resources, bring that power of convening together, I'm going to turn things back over to Dr. Huff to talk about the promise zones.
Thank you, Jason. And just for, we just have 2 more slides, and they actually, if you go to the next slide, we're introducing on this one a site within Sacramento, California, with the capital of California, where we have actually worked to do all the things that Jason went over. It is the pilot for the Climate Health Resilience Hub in the United States, well, in mainland. And so you'll see information about La Familia Counseling Center, and La Familia is a 40 years of service in the community. It's a trusted organization within the community, and it's been vetted because it was part of the Promise Zone, and it basically is the perfect launching ground, and it's demonstrated its ability by pivoting from the services you see there to some of the additional services that were covered previously, and then also with the pandemic, it added vaccinations, a point for vaccinations. It's a point now for food for people, because food security is a big thing that we're dealing with in the country. And it also is established with resources from the county agency, actually the state agency for emergency preparedness. It has established cooling centers because of the heat, the triple-digit heat in California. And the final thing I'd say about it is that we're actually working with a academic partner at UC Davis, and as Dr. Franco mentioned, young people and young adults are looking for hope. And there are some things that we're able to show them that they can be involved in that add hope by seeing this community organization or community network that's fulfilling its mission. Next slide, please. And finally, just looking at the power of convening. These are all the different resource partners that bring different types of resources to be available for the Climate Resilience Hub, Climate Health Resilience Hub. And what HUD does is HUD has the ability to convene. So we have worked to convene from local, from city, from county, from state, federal agencies. And you'll see down at the bottom, one thing I'd like to point out, the youth engagement. The RAND Corporation has a nice project model that they have given us, and it's called the Youth Resilience Corps. And what it does is it actually enables communities and neighborhoods to train young people with first responders to understand what to do, so that imagine this, across your state, each community has people within the community who know what to do. You're not waiting for first responders. You're not waiting for resources, which we know are going to take a long time. And the final thing is we're looking at adding and inculcating veterans into this group to work with the young people, because veterans have they've already devoted their lives and they're interested, and they have some things where they can give back more to the society and to their community. So marrying the Youth Resilience Corps and veterans really gives you a community-based group of assets to use. So I thank you once again for your focus on building climate resilient communities, and thank you for allowing us to be part of it. And I'd like to turn it back to Miko.
Boy, it's so hard to resist wanting to comment and then click the slide. I couldn't resist. I had to put, we're doing the same combo on Oahu. It's a dynamite combo. It's amazing. Thank you so much for your presentation. So I think what we should do, we want to make sure that we have time for Michelle to present as well. So if it's okay, what I'd like to do is have Michelle present and then have questions for all three of you at the end, if that's all right. So, okay. So I'm going to go ahead and put switch slides here, and then give me just one moment.
And Miku, I can present my own slides, so
That's
no
great.
worries. Yeah.
So I can type in the comments, right? Great. All right. So let me, I'd love to read for you a little bit about Michelle's background, so we just have a sense of her expertise. Michelle's been the Federal Disaster Recovery Officer to address the COVID-19 recovery efforts in Region 9. She spent over 2 decades working in community development, environmental health, civic engagement, and technology across the public and private sectors in the West. So she holds an MS degree in water ecology and organizational management, and apparently has a story to tell us along with the slides that she's sharing today. So with that, I'll hand it to you, Michelle. Take us away.
Thank you so much, Miko. Mahalo. And I'm gonna just see if I can share, and hopefully you guys can see. I'm gonna just do a couple of things. First, I just want to give a big mahalo to Serene for hosting this, along with the local Hawaii HUD office, Ramona. Very appreciative to be able to join in a conversation where we get to link community with resilience, with equity, with stewardship. I think that these are all really important concepts that we can bring together, and how we come together, be it before, during, or after disasters, which is typically where FEMA gets to play a lead role. And FEMA is a grant-making organization primarily that really helps to support systems and structures and processes and people in order to really be able to move through whatever kinds of shocks and stressors and threats might come into a community. And so I have been really privileged, I would say, to be able to walk into FEMA and play a role where I get to lean in and help build the capacity around our structures and partners and processes, but also on the flip side, to better understand the stories and to better understand the communities that are working through their own process of recovery. And so I'm honored to be able to lead a team where I get to really focus on how are we bringing like-minded ideas and thoughts together. And I really appreciate Michael and Jason for sharing the Climate Health Resilience Hubs. I've been a big fan of that model and that approach for a while. And I really do think that it has a fruit to offer. But I also lean in on what Robert said earlier around the fact that resilience is going to look really different for everyone. The community will really help shape what resilience is going to look like, and that is why it is so important to, as I learn, to always allow a community to be the leaders and the shapers and the formers of and the builders of how they see themselves coming together and working together, not only with themselves, but out into the world. So I just wanted to start off with that concept. And as we move through this presentation, I get to just share, some of the Pacific storytelling talk of a trip that me and my team were able to take when we went across the Pacific. So we were able to move through Hawaii, Oahu. We were able to move down into America, Samoa. We got to go to Guam. We got to go to Siem Mai, Saipan, and some of the northern islands of the Northern Mariana Islands, Tinian, and it was really, truly a learning experience. And so a big part of my sharing is really just to really quickly give you an appetizer of some of these recovery and resilient success stories and where they're placed both in Hawaii and the Pacific, and where we can actually begin to work together in the future. So in FEMA, my group is the Interagency Recovery Coordination Group, and we really work more towards how we can help mobilize community assistance. So this is really focused on where and how my group could begin to lean in from a variety of solution spaces to focus in on what the unmet needs were along the spectrum of COVID-19 and that recovery effort. And one of the really important pieces here is we recognize that there's multiple definitions of resilience. And so I just wanted to start off with language a little bit. FEMA has a standard definition right now, and that standard definition is the ability to prepare for threats and hazards, adapt to changing conditions, and withstand and recover rapidly from disasters. They're looking to really take, as Ramona pointed out, a larger one family approach to building into this definition. And there are some initiatives across the federal family, such as the long-term equitable resilience and recovery group that is focusing on this. And a lot of this really falls in vital conditions. So there's key principles. And we know that if we look at the family of resilience, it can be resilience from all threats and hazards, from people-centered work, trying to really move into more of those adaptive, collaborative, sustainable spaces, and really applying that intersection, interdependent thinking to really move into the territory of resilience. One of the things that FEMA did recently in the last year and a half is they stood up a resilience office to really begin to focus in on how they could pull together a more national space around resilience and what that vision might look like for a community, for a society, for economies, for the built environment, and for the natural environment. And I really love the fact that that vision of resilience is all-encompassing, and that there's potential to be able to move more deeply into the areas that each community might be hyper-focused in on. So in the Pacific, one of the things we were really interested in was what is this idea around linking COVID-19 recovery, which we saw in COVID-19 every possible iteration of root cause problems coming up to the surface in order to really showcase where there were needs and priorities in our communities. And so long-term recovery is an important issue. And one of the things that we did was on our month-long tour, I'm going to call it, in the Pacific Territories, we had 49 meetings. We met with 41 organizations. We had 225 touch points. It was a variety of many different kinds of people representing many different kinds of organizations, nonprofits, academic, federal interagencies, site visits. And what made this really special was just really being able to tap into the leadership and the thought thinking of all of the many diversity of people that were coming together to talk about really important issues like resilience and equity and broadband and healthcare and reaching into other areas of focus like affordable housing and homelessness and climate change. And so a lot of these topics were interrelated. We had done something that FEMA hadn't done before, which was we brought Health and Human Social Services with us to come do a health recovery needs assessment in America Samoa and Guam and CNMI to really look at health systems and infrastructure and to begin to actually link these ideas of resilience and equity into that health space. And we also were really interested in understanding how other federal family organizations, and then all the way down to local, how they were having different conversations about climate change, about broadband, about equity, really. So, a big piece of this again is we met a lot of folks, and it was really it was a fascinating experience to really begin to gather the storytelling and the ideas related to resilience. And so I want to just begin locally with where all of you are. This is just sort of a collage, and you're just going to see collages of some of the different islands here. I know that I saw John on the call, and John Rapone, he actually leads the Key project, which is pretty amazing. I consider this an incredible example of where and how resilience is being built on the island of Oahu, on the, I believe it's the east side. And what's really amazing about this is that we were able to really tap into this idea of how do you build sustainably? How do you build in a space that can be isolated, where communities are really needing to have a pinpoint space and place to be able to gather, to be able to brainstorm, to be able to get skills, to be able to tap into broadband, to be able to perhaps even have a space for post-disaster recovery. A lot of conversations were happening around this table here. And we spent hours just sharing these conversations, of which then we traveled a whole 5 kilometers over to an incredible nonprofit organization run by an incredible executive director who has so much vision, Jonathan, around where and how they were really beginning to link that cultural integrity and that spiritual integrity of space and place and stewarding the land with local taro, which could then lead to local food systems and local food resilience, which is a really important piece for how a community can build resilience within its own space and place, and how a big part of what he was doing wasn't just stewarding the land and finding new ways to introduce the appropriate ecological plant life that needed to be there, or the appropriate ways to be able to monetize, but also to really think about the different systems that needed to be in play to help support the community. And that was really important. We also, on the right-hand side, got to meet with Christina Higa and Ginger Porter, who are a part of the telecommunications and social informatics group in Hawaii, and they oftentimes lead a lot of the technical disaster management assistance around communications and telecommunications and healthcare. And so what we were doing was we were meeting with just these incredible folks that had great ideas, thought thinking, leadership, that we saw as a potential to think about how can we help lean into conversations around capacity building as we move through the Pacific territories. It was, just a big conglomeration of bringing ideas and people and thought thinking, and not just for Hawaii and the Ohana community, but also into the territories. So our next trip really leaned into jumping into America Samoa, where we got to just immediately sink in with the governor and the GAR, which is the governor's authorized representative. We met with a lot of the leadership around disaster management, emergency management, disaster recovery. And right here, you see a great picture of me and Samana. Samana is the Director of Emergency Management in America Samoa, but he is also the High Chief of the village of Liaison. And the village of Liaison was actually one of the villages that were hit by the tsunami back in 2011. And they lost community members. And a big part of what he is always having to battle is how he cares for his 1,000+ community while also managing the entire island. And as mentioned before, they do have systems for how they communicate early warnings, but they were also in a place where they have vulnerabilities and where broadband is a really huge priority for them, so that they can also step up and play in a level playing field with a lot of the other Pacific Islands and even the United States and the global market in order to compete. And so we were really just listening to a lot of these concepts, but also really bringing back that a big piece to how you think about recovery and resilience is cultural. And if you don't tap into the cultural space of understanding what's important for each place and space, you're not going to be able to find an outcome that's going to serve that community. It really has to be led from the heart. And I think that was something that we definitely walked away from in America Samoa. As we moved into Guam, again, we were connecting with decades-long leadership of folks who have spent their entire lives on the island, focusing on all kinds of many different initiatives to help build support. And what was really important here was to understand that, as you begin to have all of these meetings, to also really bring forth the themes that really are important to everybody. And for Guam, one of the things that they were really excited about was the idea of women leadership, the idea that women could actually take and move forth in becoming a governor, in becoming higher leaders in the planes of being able to help steward their island. But also on a previous trip to Guam, I was able to travel to really understand the natural spaces and places that are really being affected by climate change. And what you'll see right up here is a wildlife refuge in Guam that, if you all have been following the news, in late May, Typhoon Mawar hit the island of Guam, literally just right in that blue space that you see in the upper right-hand corner. And so it definitely created damage, and it also creates opportunity for how Guam can pull together with all of the many different kinds of organizations and leadership that's available to them to be able to build their own resilience, which is very important. We also were in the wonderful island of Siena Mai and Saipan and Tinian, and again meeting with governors and meeting with key staff that really had a lot of perspective on what was really needed on that island. And that island has been going through some change, like many places go through, and change of leadership, change economically. But one of the things that I put out here is the shack. And for those of you that have ever gone to Saipan or CNMI, the shack is sort of an anchor institution business, so to speak, serving beautiful food, but also the owner of the shack was tapped by the governor to go ahead and help lead the new broadband initiatives in order to bring internet for all to Saipan. And he doesn't know a whole lot about broadband, but he was willing to step up to the plate because he's such a strong community member, and he really is deeply embedded and passionate about growing and strengthening his own community. And the example of why broadband is so important, over here on the lower left-hand corner, you'll see these FEMA tents, right? And those FEMA tents were actually placed in front of a health center in the island of Tinian, which is a smaller island from Saipan. And they were originally going to be used for COVID-19 patients. And they couldn't actually be used for those COVID-19 patients because they couldn't bring broadband into those tents in order to be able to activate that electronic health record that they needed to be able to provide care. And so one of the things that we saw across the islands was this really, I'm going to call it uneven ability to see broadband as an equal, source and strength for the people to be able to mobilize and work in their own recovery. And so we were taking all of these issues back, and what we recognize, and what I'm going to move very quickly through because I know I don't have a lot of time, and so Nico, just keep me honest here, is we're going to do a little Hawaii community spotlight, because broadband truly was the #1 issue that we saw in recovery as being able to really leverage resources to help our Region 9 communities and jurisdictions. This included our tribal nations. There's 157 of them in Region 9. This included the state of California, Nevada, Arizona, Hawaii, and then our Pacific Territory islands. And what we saw was that broadband was how many communities could, if they had access to any kind of bandwidth, could tap into telemedicine or community hubs, stay connected to people, communications, and work. And what we found was that library systems are really great resilience hubs as models for bringing people together and being able to perhaps host a lot of these services. And we saw a little bit of that with the climate health resilience hubs. One of the things that you might all be aware of is that the Digital Equity Act of 2021 was passed. That is an act that requires NTIA, which is the National Telecommunications and Information Agency, to establish grant programs for Internet for All, to really focus on this idea of digital equity. And digital equity primarily is a human right. There's an acknowledgement across the space that recognizes that we need to be able to provide broadband in order to help all kinds of disenfranchised from being able to get access. Access is the key word. Access to education, access to healthcare, access to business services, and for economic opportunity. But it also provides the ability to tap into actually healthcare services as well. And so a digital equity ecosystem is one that there's a group called the Broadband TUI, and I will bring that into the next couple of slides, but they were really imagining a whole conglomeration of many different kinds of community-based organizations, local agencies, state agencies, federal agencies coming together to really imagine an imagination space around what a digital equity ecosystem could look like. And right now, Hawaii, again, is really uneven, even in our more populated centers around who gets access to the internet, who gets access to services and devices. whether or not that internet is reliable, what kinds of communities do or do not get to be served, and if you're in a more isolated community, do you even have access? And also, just as importantly, those literacy skills. And so they were really focused on this idea of how can we leverage equity in a space that really can help build the resilience of our community. And I think that that's really important. So the Hawaii Broadband and Digital Equity Office, they were created out of COVID-19, and they're led by an incredible leader, and his name is Bert Lum, and he really was the mastermind of this grassroots community organization that really was committed to what we could term digital equity in action, right? And so all of the HUI members, of which I think, stemmed anywhere from 30 to 60 to 100, and you would just see folks jumping on every Wednesday from noon to 1:30 p.m. Pacific Standard Time, which was probably around 9 o'clock in the morning Hawaii time, to jump in and really brainstorm about how can we really leverage the funding that's coming in order to provide this digital equity space. And so here's this great picture of some of the incredible community-based organizations, of which one of them, Teresa Higa, that's how we got to tap into her and begin to better understand that, this reaches way beyond just a small community. It really reaches into the globe. And what's so great about this is that it really couples two things together. It says, how can we bring community and geography together and really begin to find what they call the human side of technology? And so this was a really important piece of the equity equation. The other really equally important piece is this idea of community members. Kaleo Bennett is a pretty incredible human being as well. He has a nonprofit organization that he's the executive director of, and he helps build this Oamu collaborative that really is doing a variety of different events to help spread the digital equity love out into the community and into the Hawaii County. And we were able, some of my team was able to jump in and help provide some geospatial analysis to help provide a dashboard that we worked collectively together on in order to be able to highlight where activities around digital equity and community organizing and digital literacy and the understanding of needs or unmet needs might be happening, so that it could be leveraged as a decision-making tool for those influencers that are going up to a variety of many different leadership positionings and really focusing in on how they can get support for this initiative. So the dashboard is just one visualization of what's happening down into the communities of Hawaii. And what's really important here is that hyperlocal is that process of sitting down in your local community, in your neighborhood, and really listening and gathering data about the community and about what they are struggling with, or what they are finding inspiration with, and then really finding ways to amplify that out. And if it's digital literacy classes, or if it's device availability, or if it's just basic, we don't have the last mile of infrastructure that we need to be productive, then that's some of the storytelling that I get to work with my leadership on. And what we did was then we took all this learning and we were having conversations in the islands, and with America Samoa, it was really identifying where critical infrastructure was on the island to best pinpoint where could we go ahead and bring other efforts collectively together to really think about the planning for broadband. Additionally, we were working with other nonprofit organizations such as Pacific Broadband and Digital Equity, that's like looking at the download speeds of broadband in order to really challenge the FCC and their mapping, because that was really a big criteria for how funding was going to get out into communities. Again, it was going in and really listening to our friends in America Samoa, CNMI, and Guam about what their challenges were, what their opportunities were, and where and how they were organizing. Additionally, it was following the money and really understanding where is there, as Ramona says, there's been a lot of federal funding that's come down in the past couple of years, and we were really beginning to map and track that funding and ensure that our partners across the region actually were aware that this funding was going to be available. It was also organizing, so big issue that we heard when we traveled across the territories were supply chain issues and challenges of the Buy American Act, and so we were working with the Office of Insular Affairs to really think about, you know, how can we help mobilize and really bring some of these pains back into a place where we could turn them into gains. And a big part of this was there are other islands that have dealt with a lot of the same issues, and we were able to collectively bring them together. So U.S. Virgin Islands had done a street addressing initiative that they just finished to help in their efforts for broadband and community planning, and potentially it could help spaces like America Samoa have a roadmap to move forward. And then finally, in that health and climate resilience, you know, again, the Pacific Islands just seem to be narrowly avoiding, you know, the worst of whatever is coming at them. But what's really interesting is COVID-19 helped launch a whole lot of different groups to come together around equitable long-term recovery and resilience, how to use a one family approach to think about what long-term recovery means, what resilience means, what equity means, and how that fits within a vital condition. And the last piece of this is really to speak about a regional organization called PIHOA, Pacific Islander Health Office Association. They're a set of leaders across the public health sphere across the Pacific, which also includes the Commonwealth, to essentially say, how can we regionally work together and strengthen our alliance with one another in order to build that strength and resilience that we need to build back better and really approach things from a collective rather than from a separate perspective. So just lots of inspiration. And one of the things that I will do is I will copy and paste these links for you, but there's a lot of FEMA resilience resources. I have some of the examples that I shared about Hawaii. I have all of those links here and open for questions.
Yay, round of applause for all of our speakers. So Dr. Jason and Dr. Michael and Michelle, thank you so much. I had various points where I was like internally jumping for joy and a lot of leaning forward, and yeah, just thank you all so much. And I saw others doing the same. So what I think we'll do is let's try to do, I'm going to just leave open, we'll try for 10 minutes for questions. If it keeps going, we can keep going for a little bit longer than that. So I'd like to just open up the space now for questions for any of our speakers. You can type it into the chat. You can use a little emoji to raise your hand. You can literally like raise your hand. We'll just take the first person who's ready to share a comment. You can also just unmute and jump in. It's not too big of a group, so I think we can manage that. So yeah, first person who wants to comment, go ahead, go for it. You got Phil right there with the emoji. All right, you got it, Phil. Over to you.
Hi, I'm Phil Balin at FEMA Region 9, work for Michelle's group. And I wanted to point out that key project again and John's effort, because we learned so much from that community, from him particularly. My big takeaway was in building these resilient hubs, there's many different models you can follow. You can do it in pieces, and you need to look at what are your community needs, what are the stake or the project champion leads for something. So it doesn't need to be one big grant for everything. You can get, different smaller grants to help build up a composite resilient hub that can keep growing. And that was really helpful. And the other thing I've learned to take away from the trip that Michelle, and I think HHS alluded to it too, was how important it is to go beyond just putting together the digital data that we have to try to figure out where our deserts of resources are, but to actually work and touch upon the social service workers, the community leaders, and ask them, help us put ourselves into the feet of the people the shoes of the people we're trying to help. What are their barriers and needs, and add that to our only partial understanding of where these needs are. So again, my appreciation for all these consortium and abilities to learn from one another. So thank you.
Thank you, Phil. And John, yep, go for it.
Yeah. Can you hear me okay?
Yes.
If this had happened yesterday, I wouldn't have been able to get on the internet because, but I just want to really thank everybody, those who came out to Key Project. And when I think back, I mean, I'm going to be 71 this year, and when I came back from college, or even as I was growing up in the 60s, we experienced tremendous flooding. That broke up into fish pond walls and flooded the community as we know it, and so this is really an evolution for a place like ours. In response to that flooding, there was a federal, state, county effort called the Kahaluu Watershed Work Plan. This happened not only in our community, but in nearby Kaneohe and so on. And I just think about, this has been really fascinating to hear from Michelle and Phil and others and all of the speakers. For me, it's kind of like a refining of the lexicon of sustainability, finding the right terminology that helps us to bring all of these thoughts together. We've been wrestling with, one thing that we didn't really talk about, but it's sort of touched on with the notion of environmental degradation and so on, things like invasives, invasives everywhere that totally change our environment. For us here, little fire ants, albizia and so on, things that affect the infrastructure, affect our food security capabilities and so on. And so this has been most fascinating. Thank you so much, all of you, for putting this together.
Thank you, John. And we had a question in the chat here, and I hope I'm catching things right, but John Shear had a question, I think maybe I'm not sure if it was a particular speaker, but the question is, do you have any examples for successful neighborhood-based efforts in other states? So it seems like that, especially that neighborhood scale in other states.
Is that related to climate resilience or just, working together for resources? Because the promise zones across the country are, they have 5 to 7 years of this collective impact approach and making quantifiable improvements in the community. And it was even more magnified during COVID, when they had the pivot. That's my input on that. So we do have one other thing in that we have given presentations to Philadelphia. We've given presentations on the Climate Health Resilience Hub to the Midwest and St. Louis, and also to Minnesota. And so there is the interest, and they all are province zones as well.
Also, John, I posted a link. So there is an incredible person, and her name is Kristen Baha, and she is part of the Urban Sustainability Development Network, and she has an entire resilience hubs model, and they have been working across the country with communities across the country to help implement resilience hubs specifically in urban centers, is what she relayed to me. But another really great link of a space to take a look at and to see what those more hyper-local communities look like.
Yeah, Kristen Becha is one of our collaborators, and the link that I just posted in response to John's question is actually for USDN and includes examples in the appendix. So I think specific examples you can find there, John. But Kristen's great.
Yeah, Bob, go ahead.
Yeah, I just wanted to say aloha to John Rapoon. John, I think Marion Kelly, the late Marion Kelly, the late and wonderful Marion Kelly, Ula Husker and I and you worked together in the mid 90s. So I don't know if you remember me, but I'm going to be 72, so I think we're of the same generation in this work. So it's great to see you again, and great to hear all the great work you're continuing to do. Way to go! Thank you.
Oh, mahalo. My hair was brown and longer.
That's how I remember it. Yeah.
I see. We've got lots of Johns on the call today. So we've got our other John Vieira, and you go ahead. Yeah.
Hello, Miku. So I have a question for, I guess, all the speakers. I'm with HAIMA, Hawaii Emergency Management at the state level, and I'm in a new position as community outreach. HAIMA has sort of been, working to get back into the public eye as well as into discussions with the community. So my question is, as I look at what's happening in our neighborhoods around the state, there are so many great programs, so many great individuals and leaders. Serene also being a part of that on Oahu to help put all this together. And then we have FEMA Region 9, overall from the federal government, really looking to support. And I'm just seeing this gap in between, and that's where HAIMA falls in regards to emergency preparedness and resilience. So I guess my question then to the speakers is, how do some other states work with FEMA? How do communities work together to sort of fill this middle gap of, between all the great things deep in the communities as well as then in the federal government? How do we bridge that gap?
John, I can speak a little bit. There used to be a director in Arizona who worked for Arizona's emergency management called Alan Clark, and he used to say, after every disaster is locally led, and it is locally started, and it is locally finished. So I really think that local piece is essential to having an effective recovery in whatever shape or form that looks like. And typically the sphere is that you start from that local level and they're able to work within their chain or wherever their communication levels fall to be able to say, we have a network of community-based organizations that are helping to organize community, and we're in tap with their leadership to say, here are the unmet needs of this community, and that those unmet needs begin to continue to go up to the local city councils or the mayors or the governors or the emergency management or the federal level. And usually the feds are the last to hear about unmet needs, and I'll just say that. But sometimes the disaster is so big and it can overwhelm all of the different layers so quickly that the feds can come and help supplement with support and resources, I think. And so that connection piece of the middle, I think, really is the key lynch of like preparedness. How do we get the good education models out there to think about the plans? And the planning, I think, is the intersection of where your organization might be able to work with community-based organizations down at the lower levels or the higher levels, wherever they might fall, and begin to really say, have we really thought through, the different models that make sense for equity, for resilience, for this community that really wants to shape what they want to see move forward. That's my 2 cents.
I would just add, to build on Michelle's comments, that one thing that's happening in California and Region 9, so I'm with HUD, the governor's office actually convenes federal agencies around these type of topics. And what it does is it federal agencies, but also it braids together and connects the community organizations like yourself. So it brings together the federal resources with the state resources and with community-based organizations who have the input And then that way you're able to be aware of the resources. And I think that's a model that it's pretty useful. And we meet every 2 weeks. And then there are break-off groups, you know, if there's specific disasters in certain areas, then they already have a network of people that they know from local, from the community, from all the public sector, also even some private sector, but then also the federal is already braided in there with the state.
So, okay, we have a stat going on here. So there, Bob, is this one directly related to this?
Yeah, I think Dottie was next though.
Yeah, Dottie was next, and there's also Antja had one in the chat too.
Okay.
Let's go to Dottie and Antja, and then we'll take the next one.
You're muted, Dottie.
There's also 2 of you somehow.
Dottie, you're muted, please.
I think it's your other one. Maybe try to unmute the other one.
Great. Sorry, I got knocked off and I couldn't, so I came back in. But I want to really thank amazing presentations that have really been helpful to me. You know, Michelle and Jason and Kirsten, you all did great jobs. And my question is, you know, we are struggling. We're working like crazy in the Kolaloa to develop a really resilient built facility here because we are so at risk. And we've been working on this for over 10 years. And we're making waves and breaking ground, but we're having a very difficult time being supported by local government. And we'd really like some support to know how to make an impact that way. We have developed a resilience hub that is not resilient in an old facility in Hauula, but we need to move out of the flood and tsunami zone and build new infrastructure because we have no infrastructure out here at all that will protect the community in a disaster. So we've basically met all of the suggestions that were made by the speakers today. We have health, education, early childhood, social services, homeless services, food services. We have a community partnership hub, but we are really sitting ducks, sitting right next to the ocean in the flood and tsunami zone. And we're really worried about that because these services will not continue in a disaster. It will be impossible. So I'd like some suggestions on how we reach out in a positive way to DEM and HIEMA here in Hawaii and get some support.
I think Jason, are you taking that response? Yeah, okay.
Well, I guess my first, thanks, Dottie. My first question in response to your question is, have you become integrated into local emergency management? Are you part of the hazard mitigation plan?
If that means, am I working with the group at OCCS? Yes, I'm on that planning process with them for long-term disaster recovery. Is that what you're talking about?
Well, I'm wondering, yeah, I just let me, okay, I'm not going to try and purposely put Michelle on the spot here as a FEMA representative, but I think one of the really great resources to look into is the FEMA BRIC program, building resilient infrastructure. Well, I can't remember what the C in communities. I think that's what it stands for.
Well,
for eligibility for BRIC funding, you do need to be a part of the hazard mitigation plan of the either local and or state, preferably both. And so the reason that's the funding stream that immediately comes to my mind, but there is that requirement. Are you in the written mitigation plan for the community? And so I would defer to Michelle to perhaps tell me that I'm totally wrong, or maybe partially correct at least?
Oh, I think you're definitely on the right line of thinking. And I think John from HYEMA, also probably at the state level, has a perspective on where and how HYEMA reaches out to local government to think about mitigation planning, because they do have that specific team. But typically the way that it works, Dottie, is mitigation planning can be really helpful if you're in the statewide hazard mitigation plan, which basically just rolls up local mitigation plans and then embodies them into that state plan. Then there is additional funding available to you for resilience under both the mitigation and preparedness spaces that the federal government will then send down to these emergency management organizations. But again, it isn't the only place where you're going to find resilience funds. You're going to find it from HUD. You're going to find it from HHS. You're going to find it from USDA. And so one of the helpful ways, I think, is if there is a local member that you're working with in emergency management, to request and say, hey, is this happening? If not, I would say get John's number here online, because he works with Hawaii Emergency Management, and he could probably identify for you who that local person is that you should be working with. Sorry to put you on the spot, John.
No, this is great, Michelle. Thank you. So I've never had the chance yet to meet Dottie. Hi, Dottie. But I have been in multiple meetings in which we've had the conversation about Hau'ula and the project. And I'm well aware that Dottie's well aware of the options through FEMA and HYEMA. And so Dottie, we'll talk story soon outside of this meeting. But as far as HYEMA is concerned, we've been working with FEMA in the past couple of months to talk about BRIC grants, mitigation grants, and sort of, Hawaii has not really received any or hasn't been awarded any BRIC funding. There are many reasons why. So we're working on those. I think that's a can of worms for this meeting, but I want to be a part of the conversation, and I know Dottie's working with DEM and DLNR, so this is something that we're on the same page. We just have to work through it.
So Michael's got his hand.
Yeah, I just wanted to mention quickly, Dottie, I put it in the chat, but I don't know if everybody's aware of an organization called a federal agency called the EDA, Economic Development Administration, and the reason I mention them is that all they do is build facilities, okay, for workforce development. So if there's any piece of the resilience that you would be training or equipping some people to become part of the work, let's say for workforce to be part of resilient grouping or learn first responder training, that would be an outlet. So we have some contacts in Region 9 for them. And like I said, all they do is build facilities, and they might be a good resource to network with yourself in the state.
Thank you very much. We're actually really looking forward. We applied for a FEMA direct technical assistance grant and received that, but we haven't heard back yet when that will start. It's going to be focusing on Hau'ula, which is a small rural coastal community that's very vulnerable. And so we're looking forward to getting more answers when we go through that process. And I look forward to working more with HYEMA and FEMA. We have applied for a BRIC in 2020 and have not been able to apply since then because of barriers we've run into with HYEMA and DEM. So, we've got to get those worked out because we know FEMA has a lot of resources that we should be tapping into for this island and for all of our islands.
Okay, so got Bob. I do also want to make sure we leave time for the next segment of our presentation. So maybe Bob, and then we might need to move on after that.
Yeah, this addresses sort of the ability to link up these different units of analysis and different units of potential response and to resilience needs. Part of the reason I thought Kapiolani would be well situated to create something like Serene is that we're part of a 10-campus University of Hawaii system, which is also a state of Hawaii department. So, and of course, as a community college, we have a different interface with neighborhoods all around us and island-wide. So I'm still thinking there's an important role for the American Community College in this work. And then there's also the workforce development missions of community colleges. So Dottie, I would be interested in talking with you about an EDA grant and sort of a workforce development thrust. I'm aware of the tremendous work you've done over the years, but I think we need to move on to what does a resilience workforce look like? And I don't think we've had enough, we haven't put enough neurons on that particular topic. So, but I do think the community colleges have a role to play, particularly in Hawaii, because we are situated on all the islands and part of a state system that also interfaces with K-12 quite a bit. So anyway, that's just my thoughts about that earlier conversation about how do we align these different units. Thank you.
And if you guys, we still have stamina in that third hour, that was one of the suggested topics for a breakout room to talk about workforce development and how that maps to resilience hubs and what's possible there. So that's something we could bookmark. Anta, I know I saw you still had your hand up. This question about that you had put in the chat about is there a disaster, if there's a disaster and no power, why is broadband so important? And there was like a lot of conversation about the broadband. I think some of that got answered in the chat, but do you want to, wait, I think, did you take your hand down? Did we want to address that real quick again?
Well, I was just wondering about that, because if we have no power, how are you gonna, use broadband? That I don't know. I'm not very tech savvy, so I was just wondering about that.
Yeah, let's let Jason take this. I have a feeling I know what he'll say.
Now, thanks. That's a great question. So at least in the model of the Resilience Hub that's developed by Urban Sustainability Directors Network, the focal point of the Resilience Hub, the trusted structure, should hopefully have not only broadband capability, but also redundant power. So if it has its own microgrid or batteries, that could allow people in the community to come in and plug in that iPhone, plug in that tablet for both power, but also for broadband, so that they can maintain communication with their loved one, with emergency management, with law enforcement as necessary. So redundant power plus broadband. It's not is the way to address the question of what's the importance of broadband when the power goes out.
Okay, thank you. But here in Hawaii, we lose power regularly, and most facilities, especially out here in the rural part of Oahu, don't have solar or redundant power. I guess you're talking about like generators and so forth, right?
Generators or even solar batteries. So it may not be commonplace, but maybe, I don't know, that might be a good pilot concept. Can you have some redundant? You can have redundant power and broadband, allowing a neighborhood to maintain communications during a power outage.
And Anche, I think that this is the beginnings of like what would building out and retrofitting these resilience hubs look like. Resilient power being a really important piece of that. So I think this is, and we're kind of just at the beginning of that. Though I'm just going to put a bookmark out for like, but what do we do in a hurricane when slabs of these solar panels are flying around? So that's another interesting design challenge that we should talk about at some point.
I thought about that.
And one thing to just note, with Typhoon Mewar, they had power out for a long time, and it was challenging communications wise. And it really showcased the opportunity that redundant power and a resilience hub would have been a really wonderful concept there, to allow people to come and power up their phones and be able to connect with their families and friends across an island or outward bound. And so it's just a good opportunity to say, where do we have gaps and how can we do better? And I think that that's the idea of resiliency.
I would just add one last thing, and that is we're looking at a model that is used in Europe, and it's actually called a wind tree. And it looks like a regular tree, but each leaf turns and that generates power. So even in high winds, it's generating power, and they actually have a little small solar on there as well. So even in the evening or at night, you can have that. And what's nice is that they actually have these in different sites in Europe where people can just walk up and plug in right there to the wind tree. And it's about the size of a regular tree, so it's not an eyesore like these big turbines. So it's a really unique thing we're hoping to position at the Climate Health Resilience Hub.
So I know there's so much questions and continued conversation, but since we are a little bit over time, I know people are starting to some people have to leave. I'd kind of like to move us along. I was wondering if Michael and Jason and Michelle, if you have contact information that you want to put in the chat, or if it's possible for people to follow up with you if they have further questions. And I think we should probably leave it at that. Is that okay for folks? Yeah, we got some thumbs. Good. Nice. Get the responses there. Perfect. All right. Well, thank you so very much for all of your presentations and all of the questions. I know that we were really, in some ways, just at the beginning of these discussions. But I'd like to ask for a round of applause for our speakers, at least like your hands clapping or little emojis. So yeah, thank you. Thank you all very much. And looking forward to continuing.